Hi everyone, welcome back to another episode of Be a Nurse They Said. My name is Lainey and I'm so happy that you're here. Just a little recap from the first episode, a little bit about myself. I've been a nurse for 8 years. I spent 5 years at the bedside before I went into the educator role a little over 3 years ago. I absolutely love what I do. I love education. I love helping nurses and nursing students. That's really what this channel is all going to be about. I want to educate you. I want to give you advice. I want to give you guidance. I want to tell you stories that you can relate to try and help you either transition from nursing student to nurse or just make you feel a little better about things you may be going through or help you through things that you may be going through. So what I'm going to talk about today is tips and advice for the nursing student who's about to graduate and take their NCLEX. The end of the semester is coming, but it's not over yet, so please don't give up. You probably still have exams to take. I know the senioritis is real. It's kicking in. It sure has for our students. Don't worry, it's kicking in for your teachers as well. We are feeling it too, but we got to keep going. The finish line is almost there, and you can do this. So as you finish up your final semester and you get ready to take your NCLEX exam, here's a few tips for you. First, take some deep breaths. It may sound silly, but taking a few deep breaths can really help relax your mind before an exam, before you start your shift, before you do anything, really. If you don't currently do mindful breathing, now might be a really good time to start. As I said earlier in the video, I'm sure you still all have exams to take. Don't slack off. Keep studying, keep going. You still need to pass these exams so you can get to your NCLEX. You will need knowledge from the content that you're learning in school right now, even till the end of the semester. You're going to use that knowledge to take your NCLEX exam. So it's very important that you continue to pay attention in class, take vigilant notes, study for your exams, look at what you got wrong, attend those test reviews so you can really understand why you didn't get the correct answer if you got the question wrong. My next tip is to study a little bit each day. This goes for your exams that you have in nursing school, but also for your NCLEX exam. Don't wait until 2 or so days before the exam to start studying. You need to start studying every day. It doesn't have to be for hours and hours on end. I personally was never the person who could spend 12 hours in the library and leave at 2 a.m. when they closed, but it's important to at least study a little bit each day. Go home from class and study the content that you had that day. It's fresh in your mind, and that way you can realize what you don't understand and maybe seek clarification on that content. Next tip is to study what you don't know. I know it sounds simple to understand to study what you don't know, but it's very easy to fall into studying the content that you do know because it feels good to study the content that you know because you get it right and you understand it. But what you really need to focus on is the content that you don't know and study that so you can ask your teachers questions for clarification so you understand it for the exams and moving forward when you go to take NCLEX. Studying what you don't know is especially important for NCLEX because the NCLEX is an adaptive exam and it will figure out what questions that you get wrong and it will start asking you more questions about that content. For example, my weakest subject is probably maternity and pediatrics because I am not a maternity and pediatrics nurse at all. So when I took the NCLEX, I had a lot of maternity and pediatrics questions because they figured out that it was my weak spot and then they wanted to test me on that knowledge because they knew that I knew the other content that I was getting right, but a lot of my questions were based on maternity and pediatrics because that's where I'm weakest in. Next, if your program that you are attending, whether it's a diploma, associate's, or bachelor's program, if they do not offer you an NCLEX review, whether it's ATI or Kaplan or whatever service that your school uses, if they don't offer a live review either at the end of the semester or once your semester is over, I highly encourage you to sign up for one on your own and complete that because they can be very, very helpful. If your school offers it as an optional thing like mine did, I encourage you to go to it because when I was at college, I went to a 4-year bachelor's program. They did not require it, but the week after graduation, they offered an ATI live review and it was extremely helpful. It gives you the nitty-gritty, it really condenses things they usually give out some sort of book or packet or handouts or something like that for you to take notes and take home after the review. And it's a real good study guide to take your NCLEX once you get to that point. So if they do not offer it, I highly encourage that you find one on your own and sign up for it and complete that and use that to study for your boards. So the night before and the morning of NCLEX, I have a few tips for that. So the night before, obviously this seems simple, but go to bed at a reasonable time and get a really good night's sleep, because you do not want to go into this exam feeling tired and not on your game to take your boards. On top of going to bed at a reasonable time and getting a good night's sleep, I suggest that you get up at a reasonable hour and eat a good breakfast. I'm going to be cliche here, but breakfast is the most important meal of the day, and getting that good nutrition in you to take your exam is really going to fuel your brain and be at the top of your game when you go to take your test. I think they tell you to anyways, but you should arrive 20 to 30 minutes. Probably 30 minutes is a better bet early for your exam, so you don't feel like you're rushing in. The check-in process is quite extensive. They check your glasses, they check your watch, you can't have anything on you. So it's super important that you get there early so you can ease into it, you can take a few deep breaths and really get yourself ready to take your test, instead of feeling like you're rushing in there at the last minute and you're not thinking straight, because you really want to be thinking straight and on the top of your game when you go to take your test. Next, don't study the morning of your exam. I know you want to get some last minute studying in, make sure you understand something, but if you're really struggling with something and not understanding it till the morning of the test, you're not going to learn it right before you take it. So do the best you can up until then, especially with your weak spots. Like I said, you can study the day before the exam, but I would stop at a decent time during the day and really give yourself the evening to decompress and get ready to get a good night's sleep so you can wake up fresh the next day to take your test. If you do study the morning of, you may confuse yourself and contradict some information that you thought you knew. It's best not to study the morning of your exam, and that goes for when you're in nursing school too. We suggest that you don't study the morning of your exams because we don't want you to confuse yourself or contradict information that you thought that you knew going into the test and then make mistakes when you're taking your exam. When you're taking your NCLEX, don't be afraid to get up and take a break. I know during regular exams in nursing school, you're probably not allowed to get up and take a break. You have to do it straight through. But while you're taking your NCLEX, you have 5 hours to take that exam. So really take your time. If you need to take a break, get up and take a break. You are allowed to do that. Get a sip of water, go to the bathroom, really refresh and recharge your mind. Because if you sit there falling asleep or having to go to the bathroom, you're not going to be concentrating on the test questions themselves, and you may make mistakes, and that may hurt you in the long run. As I said before, this test is adaptive. You can have anywhere from 85 to 150 questions. If you have to take 150 questions, it's important not to worry yourself that you did not pass the exam. I have had plenty of students the past few years take NCLEX and have to take all of the questions. Did not mean that they did not pass the exam. So if your exam stops at 85 questions, if your exam stops at 120 questions, you could still pass very easily. So it's important not to get in your head that, oh my gosh, I had to take the whole exam, I didn't pass. It does not mean that you did not pass. Sometimes people just pick the short straw and they have to take the whole exam. So it's important to keep that in mind as well. Don't freak yourself out if you click to number 86 and the test is still going. It does not mean that you did not pass, but you just have to keep your head in the game and keep answering questions and do the best that you can. The past couple years, NCLEX has included next-gen questions. I hope that wherever you're going to school, they have started to incorporate next-gen questions into the classroom and even possibly your exams. Next-gen questions include a lot of clinical judgment, because obviously we know as nurses we use a lot of clinical judgment. So they try and pull out your clinical judgment during the NCLEX. So one way that they do that is use a different variety of questions. So it's not just regular multiple choice questions. There's other ones called bow tie questions or drag and drop or hotspot that you may see on your exam. They really use those questions to try and see how your clinical judgment is. Another way they do that is through the use of case studies. On each NCLEX exam, you are guaranteed at least 3 case studies. Each includes 6 questions. So 18 questions on your NCLEX exam are going to be involved with case studies. So it's very important that you pay attention to those case studies and the scenario, because if you mess up on the first question, there's 5 more questions that you have to answer that are related to the scenario. So it's really important to pick out the important information, because all 6 questions are going to be related to the same case. My last piece of advice is to go onto the NCSBN website and review the 2023 NCLEX test plan. This is online. You can Google it, go right to the website and look at this plan. I don't expect you to read it word for word. I think it's 50 some odd pages, but it will really give you a good overview of how the NCLEX is going to test you and test your knowledge. The NCLEX test plan will also tell you topics to review. It will give you a kind of structure of the exam, and it may ease your mind seeing how the test can possibly be laid out for you. So I know I went over a number of things today, but I hope those tips and advice were helpful to you. I hope that you take some of these tips when you take your NCLEX and when you're studying for your NCLEX. It is a huge transition to go from student nurse to a practicing registered nurse or graduate nurse, whatever position you're starting out in. I promise you can do it. I want to thank you again for joining this episode of Be a Nurse They Said. Please be sure to like and comment on this video, subscribe to my channel. Also go ahead and check out my Instagram and give that a follow. I post when I'll be posting new videos and other updates about Be a Nurse They Said. So remember, don't just be a nurse, be amazing like I know you are, and I'll see you next time.